Every year, millions of seniors line up for checkups meant to save them. But what if some of these tests, once life-saving, now quietly threaten your health? Hospitals call it preventive care. Insiders call it the fear economy. After 70, the human body changes, and so should your testing strategy. What's rarely discussed: each test carries risk: radiation, infection, anxiety, or surgery. One false test can trigger a domino of unnecessary procedures. Morgini and Shuch. A foul. According to The Lancet, nearly half of late-age screenings find harmless disease. After 70, slower metabolism alters how you heal, respond, and recover. Many physicians know these truths, but patient fear keeps old habits alive. We trust machines more than our bodies, chasing numbers over balance. Between 2000 and 2020, screenings in seniors rose 300%, despite no survival boost. Testing rules change slowly, years behind the latest geriatric science. Anxiety before, panic during, confusion after. Each test becomes an ordeal. The system rewards testing because fear keeps clinics full. Seniors deserve truth. Tests must serve health, not habit. Modern geriatric care moves from more to meaningful. BMJ Geriatrics confirms, beyond 70, preventive tests rarely extend lifespan. A new generation of doctors now says, less is safer. The goal isn't fear. It's freedom from unnecessary interventions. In this film, we reveal 5 checkups to rethink and what to do instead. Medicine's next revolution isn't new technology. It's smarter restraint. After 70, every test must ask one question: will it change your outcome? JAMA Internal Medicine found excess testing increases harm without gains. The healthiest seniors aren't overtested. They're balanced and informed. Routine is comforting, but health requires personalization. Too few doctors explain when to stop testing and why. Not, what should I check, but what truly helps me live better. True prevention now means protecting seniors from over-medicalization. Next, you'll discover the 5 common checkups that cross the danger line after 70. We begin with the one that lures the healthiest seniors: the full-body scan. Clinics sell full-body scans as ultimate reassurance. A look inside everything. Each scan equals hundreds of chest X-rays. Radiation seniors absorb more slowly. Repeated scans compound invisible cell stress, quietly aging tissues faster. A blurry shadow on screen can spark panic and invasive tests. One uncertain image leads to biopsy, then surgery, then months of recovery. BMJ Radiology Review. No life extension seen from annual scans past 70. Fear of missing disease fuels billion-dollar unnecessary imaging markets. Many recall the test that found nothing but changed everything. Waiting for false alarms raises cortisol, blood pressure, even stroke risk. Radiologists admit most tiny nodules after 70 are harmless age marks. Scans often find incidental harmless growths misread as threats. Anxiety can linger long after doctors declare all clear. Many packages exist not for health, but billing codes. Persistent unexplained pain, bleeding, or major weight loss still demand imaging. Specialists urge scan only with clear clinical reason, not for reassurance. A single CT can deliver 10 MSV, enough to nudge cancer risk 1 in 2,000. Elderly DNA repairs slower. making radiation more mutagenic with age. Rare, but real. Machine malfunctions have overdosed patients in seconds. Each clean scan feels good, until next year's fear returns. Stanford found 68% of full-body findings required no action, yet half underwent more tests. Ads promise peace of mind, but plant fear of hidden killers. One false alarm steals more nights of sleep than any disease found. Some physicians now refuse to prescribe scans without symptoms. Sometimes, the bravest act in medicine is doing nothing. Radiology Journal 2023. 30% of older imaging clinically irrelevant. Stress hormones from false alarms accelerate memory decline. Medical ethics now weigh net benefit, not just detection rates. Annual scans can drain retirements faster than they prevent disease. Loved ones often push tests out of fear of losing you. True care listens first, tests later. Experts propose AEIF symptomatic or suspicious scan. Otherwise, observe. New 3T MRI machines tempt older adults with promises of clarity. More images mean more anomalies. Most meaningless. Wisdom is knowing when to stop looking inside and start living outside. Half my senior scans never needed to happen, admits one radiologist. Ask before every test. What will this change? Selective testing saves lives and dignity. Statistics, not fear, should decide the next scan. Nor should the next scan. The best full-body scan after 70 is the wisdom to decline it. Next, the silent controversy inside men's medicine. The assay test. Every year, millions of older men take a simple blood test with complex consequences. CSA was designed to detect prostate inflammation, not as a universal cancer test. By the 2000s, it became a billion-dollar annual ritual, often without benefit. Up to 75% of elevated CAE after 70 are false positives, says Urology Today. One spike in SA can lead to biopsies, catheters, or surgeries that change everything. New England Journal of Medicine found no survival advantage from routine CE after 70. Post-biopsy infections, bleeding, and lifelong complications rise sharply with age. Some survive the procedure, but lose control, intimacy, and confidence forever. Most of what we find in 70 men grows too slowly to harm them, says one specialist. Detection often triggers panic treatment for cancers too slow to matter. Men over 70 often endure fear-based therapy that shortens quality years. Wives and daughters push testing out of love, but it often causes harm. A normal ESA doesn't mean no cancer. A high one doesn't mean danger. Today's experts favor active surveillance, not automatic surgery. Many European nations no longer recommend C after 70, citing harm outweighing help. Exercise, infection, even cycling can raise SA for weeks. The fear of what if can age the heart faster than any disease. What? Ethical medicine now means knowing when to say no. Despite evidence, many U.S. clinics still promote annual SA testing. Men like to measure, track, fix, but health isn't a number race. Testosterone therapy and benign swelling also raise SA, misleading many. National Cancer Institute confirms SA-based deaths unchanged despite decades of screening. Fear of malpractice drives many doctors to overtest just in case. Ask, if we find something small, will it matter to my life expectancy? 9 of 10 prostate cancers in seniors are indolent, never life-threatening. Some surgeons regret removing organs from men who'd have lived fine. Post-surgical incontinence and erectile loss affect half of treated seniors. Every unnecessary ESA adds billions to national health costs with minimal gain. Japan and Scandinavia now teach lifespan-appropriate testing, a global reform. Urologists urge men over 70 test only if symptoms demand. Knowing when to stop testing frees mind, time, and dignity. Couples can replace fear with dialogue, support over statistics. Major societies now classify screening after 70 as low-value care. The goal isn't early detection, it's right detection at the right time. After 70, health thrives more on calm choices than aggressive tests. If testing won't change treatment, it should happen. That's modern medicine. Seniors deserve honesty, not sales pitches disguised as screening. Education, not endless tests, is the new frontier of elder care. After 70, say testing protects peace of mind, not life expectancy. Next, the test many women still trust too long. The post-75 mammogram. Mammograms once symbolized empowerment, saving millions through early detection. But after 75, detection no longer means protection. Darworth means protection. Annals of Internal Medicine found most post-75 cancers grow too slowly to harm. False alarms lead to bruising biopsies and needless emotional trauma. Studies show anxiety from false positives can last months. Better safe than sorry still drives many to annual screenings. Canada, the UK, and Sweden now halt routine mammograms at 74. Past 75, fewer lives saved. Yet, more complications discovered. Aging breast tissue grows so slowly that detection often outruns danger. Every false alarm imprints fear that lingers in the nervous system. Innate. We find things that never mattered. One oncologist sighs. Surgery on frail patients increases mortality more than the cancer itself. Even benign results leave lasting distrust in one's body. Geriatric medicine views screening as risk until proven necessary. Modern care aims to protect elders from medical overreach. Women 75 face 30% higher false alarms than true threats. Who advises individualized screening over mass programs past 70? Clara, 80, endured 3 biopsies for growths that never matter. Fear magnifies risk, while calm improves immune and healing function. Postmenopausal tissue changes make mammogram readings unreliable. False positives often trigger months of retesting and worry. Early detection saves lives isn't false, but incomplete. Oncology evolves. Today's focus is on personalized longevity, not mass panic. Sweden's trial. No mortality difference past 74, despite 15 years of mammograms. Fragile skin tears easily during compression. Another underreported harm. Observation can often be safer than aggressive treatment. MRI studies reveal heightened brain anxiety even weeks after false results. Choosing not to test can be an act of wisdom, not neglect. The best decision emerges through dialogue, not fear. Ask, will this test extend my life or just my worry? Beyond 75, odds of false positives triple compared to useful findings. True care minimizes suffering, not multiplies procedures. Geriatric experts worldwide push for right test, right age, right reason. Insurance companies often lag, covering unneeded tests for profit. Modern screening redefines prevention as protection from overtreatment. Replacing fear with trust becomes the ultimate therapy for aging women. Minimal medicine is now a movement among leading hospitals. Among leading hospitals, after 75, mammograms offer little gain and heavy emotional cost. The power to say no can be the healthiest decision of all. Next, the screening once deemed essential, now risky past 75. Colonoscopy. Colonoscopies once revolutionized cancer prevention, catching silent killers early, but past 75, the body's resilience declines, turning routine checks into risks. Pre-colonoscopy cleansing causes dehydration, dizziness, and heart strain in seniors. Older adults metabolize anesthesia slower, raising confusion and delirium risks. Niche data. Colon perforation risk doubles after 75. Recovery time triples. After decades of clean results, new growths rarely form fast enough to harm. The Lancet 2022. Minimal mortality benefit beyond age 75. Each test costs not just money, but recovery days seniors can't afford to lose. Even anticipation of the test triggers anxiety and sleep loss. FIT and DNA stool tests now detect 92% of threats without invasion. A simple home test can spare sedation, risk, and hospital time. Many continue colonoscopies just in case, unaware of data saying otherwise. Complications rise to 3%, hospitalizations at 1 in 100 past age 75. Many feel irresponsible skipping tests, even when science says to. Geriatric gastroenterologists now say, after 75, discuss, don't default. Minor tears can cause hidden bleeding, often unnoticed, until too late. Frail seniors take longer to regain hydration and alertness post-anesthesia. U.S. Preventive Services Task Force. Routine colonoscopy stops at 75. After 2 clean colonoscopies, further ones rarely alter lifespan. Aging bowel walls thin. Even air pressure can harm during procedure. Clean colon doesn't mean invincibility. New issues can arise elsewhere. Nutrition, hydration, and gut movement protect colon health better than scopes. High fiber, low sugar, and daily movement lower colon risk by 40%. JD and Mammy. Adult children often urge scans out of love, but fear drives it. Sedation-related confusion can last days, sometimes triggering cognitive decline. Insurance incentives quietly promote unnecessary re-screening cycles. Many hospitals now replace routine colonoscopy reminders with risk-based alerts. Medical ethics now ask, does this procedure extend life or just extend billing? After 75, colonoscopies only for new bleeding, pain, or unexplained anemia. CT colonography and FIT tests deliver clarity with lower danger. Non-invasive testing lets seniors walk home same day, alert and strong. True medicine weighs benefit against burden, not habit against fear. Geriatric guidelines discuss screening and age before 75. Many feel peace after choosing fewer procedures, not guilt. 70% of colon protection comes from diet and daily fiber, not scopes. If your body feels fine, your colon likely is too. Doctors now teach Prevention through lifestyle, not lifelong testing. Stopping needless tests restores autonomy, the right to rest, not worry. After 75, colonoscopies protect peace of mind more than physical health. Next, the silent heart tests that lead many into danger. Stress tests and angiograms. Even without symptoms, millions of seniors undergo yearly heart tests, just in case. Doctors order tests for reassurance, but sometimes reassurance carries risk. Jack reports nearly 60% of senior stress tests are unnecessary. One false positive can cascade into angiograms and risky stent surgeries. Angiograms can cause bleeding, stroke, or kidney injury, especially after 70. Detecting blockages doesn't always prevent attacks. It often triggers overtreatment. Without symptoms, most test results lead to more procedures, not better outcomes. Circulation Journal. Stress testing in healthy seniors offers no added lifespan benefit. Anxiety spikes blood pressure during testing, ironically distorting results. From false ECGs to stents, every added step increases harm risk. Cardiologists now admit routine testing in asymptomatic elders is outdated. Blockages found on scans rarely predict heart attack locations. Studies show walking daily lowers heart risk more than any test. False heart results can haunt patients for years, living like they're ill. A single unnecessary stent can cost $30,000 with no life gain. Symptom-driven testing only is the modern cardiology mantra. Yale study. Stress tests in healthy seniors increased surgeries by 45%, mortality unchanged. The quiet heart beats best when left undisturbed by false alarms. Angiogram sedation can impair cognition for weeks. In fragile seniors, regular walking, deep breathing, and laughter outperform many machines. More tests mean more procedures, even when hearts are perfectly fine. American Heart Journal urges risk over routine for seniors. Fear-driven tests create stress, the very trigger for heart strain. Industry ties quietly fuel testing. Machines earn while patients lose. Ask your doctor, what risk factors, not machines, define my heart health? Nutrition, blood pressure control, and movement beat all screens combined. Compassionate doctors calm worry before ordering wires. Medicine evolves. Now, silence and restraint can save more lives than stents. For healthy seniors, the best heart test is often none at all. Next, the blueprint for smarter aging: when to say no and when to test. You've seen the hidden side of routine tests, the harm behind good intentions. Medicine's future isn't doing more. It's knowing when enough is enough. After 70, think twice about these 5: full body scans, CSA, mammograms, colonoscopies, and heart tests. Less medicine, more life isn't defiance. It's evidence. The best test is the one designed for your history, not your age alone. Every unnecessary test steals hours that could be joyfully lived. Peace of mind grows not from machines, but from informed calm. A modern physician's guide, not command, your choices in aging. Families must replace panic with dialogue. Ask what truly matters most. Fewer tests, more movement, deeper sleep, better food, longer peace. From Japan to Canada, geriatric care now celebrates wise screening. Simple living reduces more disease than complex diagnostics ever will. Choosing fewer tests heals fear, the greatest illness of aging. Experts estimate 40% of late-life screenings cause more harm than help. If it won't change treatment, don't test it. The new rule of wise aging. Sometimes the bravest medicine is none at all. Awareness, not avoidance, keeps you truly healthy after 70. Real prevention starts with understanding, not overreacting. Medicine saves lives. Wisdom saves living. Which of these 5 tests surprised you most? Share your thoughts below, and share this truth with someone over 70.